So it's good to see everyone here today. Hopefully, we have a few more folks joining us in a little bit, but we're going to go ahead and get started with our topic of today, and that is going to be uh, nutrition and back issues. I may be saying that a little wrong, but that is going to be what our focus is today. And our speaker is Roberta Jump from Lexington Medical Center. Always a good presentation, so we're looking forward to this. Please remember this is being recorded, and if you would mute yourselves, but Roberta will let you know when it's time to chime in and unmute because she does like a lot of feedback from the participants. So we're going to go ahead and get started with Roberta. Take it away,
Don't know how to mute.
I'm sorry?
I don't know how to mute.
Okay, in the bottom left side of your screen, you should see a little microphone.
No. Mine's just messed up, I guess.
Okay, are you on your phone or your computer?
I'm on my phone.
Okay, Natalie, do you know how it works with the phone in the Zoom?
I want to say that maybe on your phone that there's like 3 little dots, maybe to the right, and I think you can click on that and it'll bring up other options.
You
And
see
from
3
that,
little dots? Oh,
yeah,
she did it. Yeah, she did it. I see that you are muted,
very
Miss
good.
Anna. Okay. All right, so let me minimize this because you're seeing the screen. So everybody, can you see the slides?
Yes, ma'am, I see it.
Okay. All right. So this presentation is on back and neck pain, especially for people with diabetes. And this is based on an article by Dr. John Clark, and he is an orthopedic surgeon by trade, and he specializes in preventive medicine. So it's great to have somebody who's knowledgeable about orthopedics and the skeletal system, and also an expert in orthopedics and preventive medicine. So back pain can be disabling, and I know that we all know that. We've met people that have had back pain that has disabled them, or we experience it ourselves at times. But in the last 15 years, physician visits for back pain have increased by over 40%. It's the second most common cause of disability in the US. An estimated 149 million days of work per year are lost because of back pain, and the cost is 100 to 200 billion dollars annually. So it's definitely something that people need to know about and how to prevent. So here are some risk factors for back pain. Do any of you want to admit any of these things that affect you? Are we
have the
driving?
sedentary occupation.
Yeah. A lot of us sit at computers or watching television. We're physically inactive. And for even people that are standing up, if it's prolonged standing in one place, that could be a risk factor. Frequent twisting or bending. Some people have jobs, they do things that involve their back like that. Tall stature. The taller we are, a lot of times the more at risk we have because our spine is longer and more at risk for twisting and turning. Did you ever think that depression, stress, fear, or anxiety would be a risk factor for back pain? A lot of people don't think about that, but it definitely could be. And so if we have these risk factors and then we have a trigger event. So we have the risk factors, maybe our muscles around our spine are not really strong. And then we have a lumbar strain, or we have a traumatic fracture in a car accident, or we have some discs that are breaking down and herniating. If we have a little crack, in some of the bones in our spine, this could be a trigger event to cause a very disabling situation with our back. Did you know that there's a relationship between back and neck pain and our electronic devices? Why do you think that is? A lot of times we are, especially when we're looking at our electronics, we tend to look down, and our head is just putting a lot of stress on our neck, or we're not in the right posture when we're working at our computer, or if we're watching television. We're not keeping our shoulders back, we're not keeping our head straight, we're looking down, we're hunching over. And some of these positions that people stay in when they're using electronic devices can definitely put a lot of stress and strain on the neck back. Daily use of a laptop increases the risk by 40%. A cell phone in the lying down position increases the risk by 23%. And then half laying down, it increases the risk by 49%. And the more hours we use our electronics, the more risk we have. And the tablet is 67%, so that's even higher. So here's some red flags that might let us know that we're getting into trouble with back or neck pain. If there's any history of cancer, because pain could mean that we might have a recurrence of that cancer. Unexplained weight loss, because it too could indicate cancer. If we have the diagnosis of osteoporosis or osteopenia, we know that the bones in the spine and the neck might be breaking down, and there might be a herniation later on that could cause the disability. If we use too many of the steroids, because they could lead to osteoporosis and resulting fractures. So whatever folks are using corticosteroids for, it would be great if there's a way to use something else to be able to get off those steroids, because it could cause back and neck pain eventually. As we age, unfortunately, we tend to be a little bit more frail and make us more susceptible to back and neck pain. Intravenous drug use and fever, back pain at rest or at night, or bowel or bladder dysfunction, because it might indicate advancing disease. So what about surgery? Somebody has some back pain, some neck pain, and they want to go to the surgeon and have some surgery. Well, what does the orthopedic surgeon, who's a preventive medicine specialist, say? Surgery is not a panacea. Most of the time, after 2 years, most patients are the same, whether or not they opted for surgery. And there may be some good reasons for surgery, like loss of bowel or bladder control, or if the person is gradually losing their motor capabilities, or other uncontrolled pain. But for a lot of cases, then some of the things that we're going to talk about can actually help a little bit more than surgery. So in a lot of instances, what is the source of back pain? Well, it has to do with the anatomy in the back. And so when we look at the spine, we see that they are bones in the back with some discs in between those bones. We call the bones the vertebra. These discs are alive, and so they have to bring in blood flow, and they have to bring in nutrition, and they have to get rid of toxins or waste products. And so there's only blood flow. I don't know if you can see this picture right here at the bottom, but if you see there, that's a picture of a disc, and then around the disc you see a red line. And that shows us that the blood flow is only at the outer edge of the discs. So the middle of the disc do not have blood vessels running through them. And so if we don't do something to help that disc and that spine, that vertebra, have blood actually pushed into the area, then the circulation is not there, and we could have a breakdown, and that could lead to back pain. So I didn't know if you knew that. I did not know that until I put this together. But there's no blood vessels within the discs, and so we have to do things in order to help that blood flow to get through to the disc. Is there any question about that? Okay. So just like almost anything in the body, if we have perfect circulation, then we can expect perfect health. If we don't have perfect circulation, then the health is going to be compromised. So if there's any problems with the blood flowing into the discs and the blood flowing out, the nutrients and oxygen coming in and the waste products coming out, then we're going to have problems with the discs. Another interesting thing about the anatomy of the spine is if you look at this picture at the bottom right, what you'll see is at the top of the aorta, that's that curved part of the blood vessel that comes off the heart, you see that the first few blood vessels that come off of that curved part, those are at a Y angle. So the blood can easily flow and doesn't really get stuck in those areas. But as you come down to the spine, you see these little blood vessels that are coming off at a right angle. And so because that's not a Y shape, it's at a right angle. If there's anything to impede or inhibit the flow of blood from that aorta into the spinal area, there's going to be some clogging up there. There's going to be some plaque buildup. And that's where we see circulation actually being decreased in that area. So plaque buildup in these areas of the spine will eventually cause disc generation and back pain. So circulation is huge when it comes to avoiding back pain. Sometimes there's more calcium in the plaque in the aorta than in the vertebrae themselves. And whenever there's calcium clumping together, then the calcium can end up clogging the spinal blood vessels. And so the blood vessels can be plugged also due to inflammation. So if we have inflammation in our body and we have a lot of calcium buildup, we can see that plaque builds up quickly. And those blood vessels that come off the aorta into the spine, those are very tiny. So it doesn't take much to clog them up. So if we have inflammation and inflammation is squeezing the blood vessels, you have less and less blood coming to the spine. So if we have that situation and then we work hard, let's say we lift heavy things and we do some exercises that put a lot of stress and pressure on the back, then the discs will wear, but they won't repair. And so we'll be constantly breaking down these discs. So two of the most important things to remember in helping to avoid back pain is to decrease inflammation and then just be careful, especially the older that we get, we want to be careful about our workload. So decreasing inflammation, being careful with how we use our back. Any question about that? So here's an aggressive back pain protocol, and this is what Dr. Clark recommends for people that come to him for back pain. And I'll go through the protocol, and then the last few slides, we'll talk about why he recommends these things. So this is a 1-week aggressive back pain protocol. So when we get up in the morning, we want to drink 2 12-ounce glasses of water and then wait to eat for 30 minutes. Why do we want to wait? Well, we want the stomach to be able to absorb that water, and we don't want to dilute the breakfast that comes 30 minutes later. So we want to drink the water, we want the water to absorb, and then we want the stomach empty. And then 30 minutes later, we only want oatmeal. Now we can have toppings for the oatmeal, which would be a plant-based milk, nuts or raisins or other kinds of fruit, but we don't want to put any sugar on it other than fruit. And we don't want to put any oil or margarine. And we'll talk about why. Then you want to take 500 milligrams of vitamin C with breakfast. We want to take a 10 to 15 minute walk right after breakfast. Now he says rain or shine, dress for the weather, but if it's way too hot or it's way too cold, we can do a walk. If you can find a little walking path in your home, just walk up and down the hallway or try to walk around your kitchen counter if you have one. But if you can go outside, that's better. And then 2 hours after breakfast, you want to drink another 2 12-ounce glasses of water. We'll talk about why again in a little bit. For lunch, we want to eat only vegetables, raw or lightly steamed, nice salad. We don't want to have any oil or excess salt. If we want salad dressing, then we can make our own salad dressing. Cashews and a Vitamix make a wonderful salad dressing. You can make your own salad dressing with sunflower seeds, lemon juice, and herbs, and that's delicious without adding any extra processed oil. We want to take another 500 milligrams of vitamin C after lunch, go for another 10 to 15-minute walk, and then 2 hours after lunch, drink another 2 12-ounce glasses of water. For supper, and we want to have supper no more than 3 hours before going to bed, we can have just fresh raw fruit. If we have diabetes, we want to have a little bit of protein with that. So I think it's fine to just have a few nuts maybe along with that. And that would be a nice, easy meal to digest. We want another 500 milligrams of vitamin C. Take another walk for 10 to 15 minutes. 2 hours later, drink another 2 12-ounce glasses of water. We want to avoid anything with caffeine, avoid tobacco, and we want to avoid eating in between meals. If we do get hungry between meals, we want to drink ice water, because not only will that help with our appetite, that also helps with lowering the blood sugar if it tends to be a little bit too high. So that is the aggressive plan for 1 week to see if it will help. Now, why should we have the water? In a lot of cases, our discs in our back are actually dry. They do not have the hydration that they need in order to be soft and flexible and move with the back. If we're low on water, the body is going to shunt that water to the places that it's needed most, preferably the brain, the heart, the lungs, and then the spine doesn't get what it needs. So we definitely need plenty of water. We already talked about this in another Zoom meeting, but we want to take our weight, divide it in half, and that's how many ounces of water that we need every day. And we actually need more if we're outside and it's hot and we're sweating. Okay, the way that you can tell if you're well hydrated is the color of the urine. The lighter the color, the better the hydration. If your urine is light, that means that your back is getting the circulation and the water that it needs. So not only can the discs be dehydrated from lack of water, but whenever there's pressure put on those discs, that can squeeze out that water and it can dehydrate the discs as well. And so if you're dehydrated to begin with, and then you're lifting heavy objects, then your discs are definitely going to be missing out on a lot of the water that they need in order to stay flexible and hydrated. Any question about the benefit of water in helping to avoid back pain?
I have a
Well,
question.
okay.
Would water help with a bulging disc in the back?
It may, if the disc is bulging and it's dehydrated, it may cause more pain than if it's hydrated. But in a lot of cases, because that disc is bulging, then it's got the pressure of the vertebra squeezing, and there's pain from that. But in almost every case, the hydration would be better. And so if we have the hydration and then we avoid lifting the heavy objects, that keeps that bulging disc from having way too much pressure. So that's a great question.
Yeah, thank you.
Very good. So why is oatmeal recommended for breakfast? Well, oatmeal is a whole plant food, and it's not really that refined, especially if we get the oats. We call them oat groats, and they look like little kernels of rice. And you can cook that oatmeal just like you can cook rice. It takes a long time because there's a fiber cover on it. It does have lots of fiber in it. It's a soluble type of fiber, so it's very helpful in a fluid and hydration. It can keep us from developing constipation. It can help us to be regular, and it can help grab that cholesterol that might be in the system and lower the cholesterol, reducing the chance of plaque buildup. And we said that because those blood vessels come off the aorta in a right angle, and we get that cholesterol and plaque buildup, If we're reducing our cholesterol, then we're reducing the risk of the plaque buildup in those arteries that are coming off the main aorta. A lot of times oatmeal has been related to reducing musculoskeletal pain, which is good. And it means that it's a displacement phenomenon too. So it means that if we're eating a lot of oatmeal, it's very filling, right? And so if we're filling up on oatmeal, we're not hungry till the next meal. We're not going to be snacking. We're not going to be eating things that might be high in sugar or high in fat. And that's actually going to help with our circulation, our weight control, which is going to help with our back, reducing back pain if we are at the weight that we need to be. And it's just an overall good type of food that we can have for a lot of reasons: cholesterol lowering, appetite control, displacement phenomena. This is the first time I heard that quote. I like it. Okay. So the best way to make oatmeal: 2 cups of water, a half a cup of whole rolled oats. We want to add some oat bran in there, and that's going to even be more fiber. And then we want to add some ground flaxseed. So that flaxseed is high in omega-3. It's great for the brain. It's great for our circulation. It's a great source of protein. And that way we don't have to think about adding another type of protein to our oatmeal. And then a little bit of sea salt, Himalayan pink salt, Celtic salt, any of that. And then we want to let our oatmeal simmer for a good long time. And then we can add fresh fruit to that, nuts and seeds. And the nuts and the flaxseed are going to be our protein to help control our blood sugar. The seeds would also be a good source of protein. So it's very yummy. And this is the recommendation for a whole week. If you try this and the back feels better, why not have oatmeal every day? You can just rotate the type of fruit that you use, rotate seeds and nuts, and it definitely helps with those things that we talked about a few minutes ago. So what about processed foods and back pain? If we are eating foods that are highly processed or refined, what happens to the nutrition in those foods? Well, it's definitely decreased. And we said that the spine and the discs, they need nutrients. So if we're not having the nutrients because our food is processed and there's no fiber, that's going to really affect our circulation, and it's going to decrease the nutrient quality of the blood that's going into those discs. If we're eating a lot of processed foods, our blood sugar levels do what? A lot of times they go up because there's lack of fiber, and that's not going to allow the blood sugar to stay stable. We have increased blood cholesterol and triglycerides. A lot of processed foods are high in fat, and that contributes to that. We have a high sugar level. So that extra sugar, it sticks to the little red blood cells, it sticks to the nerves, it sticks to the inside of the blood vessels. And so we see a high A1C. And when we see that, we know that there's sticky sugar that's being accumulated in the blood vessels, and maybe even in the blood vessels that go to the discs. The United States, in doing this presentation, they had a graph of the different countries around the world and the percentage of ultra-processed food that they eat. And I thought it was high when I saw some European countries eating 20% or 30% or 40%. And then it shocked me when I came to this statistic. It said the US consumes over 60% of our diet as highly processed or ultra-processed food. So think about the lack of nutrients in all of that highly processed food, the lack of fiber. Does it mean that we can't ever have highly processed food? No, we all like some chips every once in a while, or maybe a cupcake or something like that. But for the most part, we want most of our food as whole and lots of fiber, because it's not only going to help our blood sugar, but it's going to help us prevent cancer. It's going to help our circulation. It's going to help prevent the plaque buildup, and it's going to help our weight too, and our back. So I think we talked about this in the last presentation, but the changes to the blood cells, whenever there's a lot of sugar in the blood, whenever there's a lot of fat in the blood, the little red blood cells, they start to clump together. And you can see that in the picture in the bottom of this slide. There's some little red blood cells that are by themselves, but then you also see some of these little red blood cells that are in chains, and they clump together, and this is called rouleau. And when these little red blood cells rouleau, do you think that these clumpy blood cells, it's harder or easier for them to get through the little blood vessels? What do you think? You think the clumps are easier to circulate through the blood vessels or harder? No one has an opinion? Okay. It's actually harder. So the things that cause rouleau, like we said, are sugars, refined starches, fats and refined oils like cooking oils and margarines and butter and animal shortening. If we have the fat that's in avocados or olives or nuts or seeds, that does not tend to rouleau the blood cells unless we eat too much. Just a little bit of the natural fats would be better. So they don't circulate well, and if they're not circulating well, the little red blood cells, they're not going to be able to get to the discs and circulate through the discs. And so that could increase the back pain. A lot of times, Dr. Clark will just tell someone, just drink a lot of water and try to avoid these foods that cause rouleau. And it's amazing how much better the back of that person feels. So again, the refined oils such as margarine, butter, cooking oil, animal shortening, they can cause this rouleau. And this statement, the second statement, is really amazing. When we eat a high-fat meal, within 6 hours, the oxygen in the brain falls below 70% and does not return to normal for 3 whole days. So that's been measured in the brain. But is it also fair to say that that high fat content in the blood, could that also affect the oxygen in the discs for 3 whole days? It would be fair to say that. And so when we have too much oil and fat, especially if it's refined, that can actually decrease our blood flow throughout the body and cause back pain, more back pain than if we didn't have that high fat meal. So again, the best choice for fats would be our plant-based fats, avocados, nuts, olives, and seeds. Or if we want to use a little bit of cold-pressed oil in our salad dressings, like our omega-3s, then we want it to say cold-pressed. And when it's cold-pressed, we need to keep it in the refrigerator. Okay. Omega-3s in moderation are great for helping to prevent our discs from degenerating. So that would be our flax seeds, our chia seeds, our hemp seeds. There's omega-3 in walnuts as well. Okay, so any questions about fats and back pain? This is really important. Okay. What about fiber? So if we don't get enough fiber, we get constipated, right? And if we're constipated, this could have an effect on the back. So things are clogged up, we get clogged up and we get constipated, and the back could hurt more. Our intestines are filled with trillions of bacteria, and the bacteria, it depends on what we eat. If we eat a lot of sugar, then that would feed the bacteria that grow yeast, right? If we don't eat a lot of sugar, if we eat a lot of fiber, then that feeds the bacteria that helps our back pain to be decreased. So eating fiber physically feeds the bacteria that are going to decrease our back pain. Eating refined foods feeds the bacteria that are going to increase our back pain. It's amazing the relationship that we have between the bacteria in our gut and our immune system, the way our brain works and depression, the way our circulation works, and lots of different things. So eating healthy foods really helps our back pain from a lot of different perspectives. Okay. So again, we want most of our food unrefined and unprocessed, like our fresh fruits, our fresh vegetables, our nuts and seeds, our beans, our grains, all of these things that are whole and unrefined as much as possible. So fresh fruits and vegetables have the following advantages. A lot of them have antibiotic properties, especially garlic, anti-allergic benefits. A lot of people have allergies and they can't understand why. And a lot of times, if our diet is full of ultra processed foods, we don't get these anti-allergenic benefits from our whole foods like our fruits and our vegetables. Again, the more we eat of the fresh fruits and vegetables, the less risk of cancer. We're reducing our inflammation, and we said earlier that if we have inflammation and we have too much calcium circulating in the blood, then that could cause a plaque buildup right where those little blood vessels come off the aorta that go to the spine. The fruits and veggies also help our immune system. It gives us lots of antioxidants. And these are the types of foods if a person wants to improve their back health and avoid back pain. Pardon me. Fermented foods can cause inflammation, which can deteriorate the discs. And so we don't want to have fermented foods as much as possible. We want our whole fresh foods. The fermented foods may also have a negative effect on the liver, kidneys, and brain function. We are seeing a lot of push to eat fermented foods because of the prebiotic benefits that they have in the body. And that's true, they do have a prebiotic benefit, but we can get the same effect from eating fresh fruits and vegetables. Those prebiotic qualities of the fresh fruits and vegetables, nuts, seeds, and beans, they feed the bacteria in the gut, and the bacteria cause a natural, non-inflammatory type of fermentation that's going to benefit the body. But if we eat the fermented foods, then that could cause the inflammation that we don't want to have. What happens if our blood sugar is too high? Well, in just about every presentation, we talk about high blood sugar resulting in thick, sludgy blood. If the blood sugar is high and the blood is thick and sludgy, do you think that the discs in the back are going to be having the circulation that they need? Absolutely not. So if we have thick, sludgy blood sugar's high, we have obesity, which puts pressure on those discs in the back. And then maybe we do some work where we're doing heavy lifting and we're dehydrated. That is a recipe for disaster for the back. We're more likely, if we have a trigger event, to have disabling back pain. I mean, back pain that might last for the rest of our lives. So there's a significant association between sugar intake and back pain. Sugar consumption increases the risk of back pain by how much? Can you read that? 84%. Very high. Is it important to eat on a schedule? It's very important. There's people that have pain in their back, and after they start that aggressive program that we talked about, the pain doesn't resolve until they make their mealtime consistent. And once people eat at the same time every day for a whole week, they start to have better results. Okay, so we don't want to eat inconsistently. We want to eat at the same time each day. We want to avoid having snacks because that starts the whole digestive process over again. And the body is so busy digesting food all the time that it doesn't have time to focus on maybe healing the body and repairing tissues, decreasing inflammation, things like that. Again, if we feel hungry in between meal times, drink that cold water. We could also brush our teeth after a meal. Hopefully that will keep us from wanting to have snacks. Is it important about sleep and back health? Yeah. One of the things that keeps us from sleeping well is having a large meal before we go to sleep. So it's recommended, if we have diabetes, we may have to eat depending on the types of medications that people are on for diabetes. But if we're not, if we have diabetes and we're on a medication where we don't have to eat, that third meal, or if we don't have diabetes, we want to avoid diabetes, we can actually skip that third meal. I know in our culture that's hard because we work all day. A lot of times people skip their breakfast and their lunch, and then that third meal, that supper meal, that's their, family time. It's the time that they actually have, time to relax and sit down and eat. And I understand that. But if we can make that third meal as light as possible and at least 3 hours before going to sleep, that allows the body to regenerate not only the brain, but also if there's any damage and inflammation in the back, it helps the body to try to heal itself during those sleeping hours. So we have the original diet, fruits and nuts and beans and vegetables. And if we follow that advice, we're going to have a lot better results. Here's some harmful habits for the back. Anything with caffeine because it's dehydrating. Tobacco, nicotine is a stimulant. Smoking also decreases the available oxygen for the spinal tissues. It increases oxidative stress. People who smoke have a much higher incidence of back pain than people that don't smoke. How about our emotional health? Diabetes, distress, or depression. Stress and trauma can cause a decrease in blood flow to the important structures in the spine, and we know that anything that decreases that blood flow, the spine is not getting the oxygen it needs, the spine is not getting the nutrients that it needs, and there could be an increase in back pain. People with high anxiety have 2.5 times the higher incidence of back pain. People that are lonely have higher risk of back pain, poor job satisfaction, and stress. So whenever we help to try to relieve our stress, a lot of times that has a positive influence and we don't have as much back pain. Forgiveness is very important. A lot of us, there's things that have happened to us in our lives, and it's very hard to forgive. And I know if any of you know anyone with cancer, a lot of times emotional counseling with cancer, forgiveness is very important. It's encouraging for people with cancer or people with depression to try and forgive, to give forgiveness to those that have hurt them in their lives. But even when it comes to back pain, if we can learn to forgive, a lot of times that releases the stress and the tension in our body, the anxiety. It allows us to relax and it allows the body to heal itself. So there's some heavenly stress management. There's a spiritual aspect to managing our stress. Vitamin C is recommended for back pain because most of our connective tissues are dependent upon vitamin C for repair. So if we don't have enough vitamin C, we have scurvy. It's a condition called scurvy, and that is a condition where a person's connective tissues deteriorate, and including those in the back. Vitamin C also helps to thin the blood, and that promotes circulation. It's an antioxidant, so it helps with inflammation. And we can take the vitamin C, the 500 milligrams with each meal, but we can also receive the benefit of vitamin C by eating foods that are high in vitamin C. And I hope you like things like kiwi and pineapple, cabbage and red peppers, citrus fruits. All of those are very high in vitamin C. And they may not have a high milligram amount. So for an example, if you eat an orange, there's about 80 milligrams of vitamin C in that orange. But because of the other phytonutrients, plant nutrients in that orange, that 80 milligrams of vitamin C helps us to have the same benefit of a couple 300 milligrams of vitamin C, just because like a vitamin C booster that's in the oranges. And so whenever we eat foods that are high in vitamin C, we get a wonderful benefit of that. Walking in sunlight. So whenever we talked about the circulation that goes around the discs, when we pump oxygen and blood and nutrients into the disc, that's called cyclic loading. And so we have to diffuse some of that blood. So the blood's circulating around in the disc. Whenever we do our exercises properly, it diffuses those nutrients into the discs. And so one of the best ways to do that is walking. So I hope you all like to walk, especially if you're swinging your arms and you're moving your legs and you're getting sunshine, you're getting fresh air. You're really increasing the oxygen levels. You're breathing the oxygen in because you're walking, but that action of walking is also pushing those nutrients, pushing that oxygen, pushing that blood into the discs. And so the nutrients are going in and the waste products are coming out, increasing the health of those discs tremendously. So we talked about walking is the best exercise. We want to do it in the sunlight because when we walk in the sunlight, we're also making vitamin D. And if we walk in the morning in the sunlight, the early morning sunlight, we make more melatonin. And so if we have melatonin and vitamin D, the melatonin actually helps us to sleep, and the vitamin D levels help to support and strengthen our bones. Stretching. So if we're careful with our stretching, the older we are, the more careful we have to be. But there's some great stretches and exercises that can help to relieve back pain. You always want to check with your provider, your doctor, or your nurse practitioner before you do the stretches or the exercises. So one exercise that we can do is we can bend over, and we can do this while we're standing, or we can also do it while we're sitting in a chair. Here's one of the most important things about doing these stretches. We want to hold the stretch for 2 minutes. And that doesn't sound like too long, but when we actually try to do it, we say, oh, it seems like a long time. So if we're stretching for 2 minutes, that will allow those muscles around the spine to stretch out and not rebound. If we don't do it long enough, then the muscles can rebound and just get tighter. But if we do it for a full 2 minutes, then we can actually feel that relaxation and then we can actually help the back. So this is the first one, bending forward, holding it for 2 minutes. The next one would be an extension stretch. So if we can't get on the floor, you can actually do this on your bed. You can lay on your stomach and push up with your arms and try to leave your tummy on the bed and hold that for 2 minutes. Next is a twisting stretch. We need to be very careful about that, but you can do it. You can sit in a chair, put your arm around the back of the chair, and just turn yourself and hold that for 2 minutes, and then turn the other way and hold that for 2 minutes. That really helps the back and helps the muscles to relax. This is a stretch that we can do. We can lie on the floor, we can lie on the bed, and you can just lay on your back, and then you can put your leg up, one leg up, and then take your other leg and try to just put it up by your knee, kind of like at a right angle. And that stretches out the hips, and that helps with circulation in that area in the lower back. Hold that for 2 minutes. Windshield wiper stretch. We can stand against the wall. We can hold our arm up, our other arm goes down, and we can bend over and just easy bend over. And we want to hold the stretch for 10 seconds, come up standing straight, and then you can bend the knee and then go to the other side. So you can just do that a few times, 10 seconds each time. Do 4 deep breaths while you're doing that. And you can do this 6 times or 6 repetitions once a day, back and forth 6 times. Neck stretches for people with neck pain. You want to do this for 2 minutes. You can turn your head as far to one side as practical. Try to put your chin over on your shoulder. Just hold that for 2 minutes. You can flex your neck down to your chin. Hold that for 2 minutes. You can do this on the other side too. Okay. And then you can extend your head, look up at the ceiling for 2 minutes. If it feels like it's too much stress and pressure on your back, you can just support the back of your head a little bit. If you feel faint, just stop it. Okay, you can sit down while you're doing that in case you feel faint. but you definitely can do some flexing stretches for your neck. Then you can try to put your ear on your shoulder. Try to hold that for about 2 minutes each. And then you can do some resistance exercises with your neck. You can put your hand against your forehead and press against it for 2 minutes. And then you can put your hand on the back of your head and press back for 2 minutes. And then you can press to the right for 2 minutes. And you can press to the left for 2 minutes. Put some resistance there, and that will strengthen your neck muscles and help reduce the chance of neck pain. Aerobic exercise, again, the best one is walking. Also, we mentioned doing it for about 15 minutes after each meal. That's great for helping the back and the circulation and the digestion and the blood sugar. It doesn't do a lot for the heart. It's good to try to do 30 minutes if you can at a time. If not, that's fine. But if you can do 30 minutes at a sustained heart rhythm, then that will actually help your heart and your circulation. And again, it's best to exercise outside if we can. So in summary, water is extremely important. Nutrition is extremely important. The right exercise is very important. And if you like, I think Natalie is going to put this presentation on the Facebook page. And so it has the Northern Lights healtheducation.com. You can actually see the presentation by Dr. Clark, or you can read the actual article. So any questions on the presentation? You were all way too quiet.
We had ourselves muted.
I know, but I was asking questions and no one wanted to say anything.
Yeah, I like the
We're listening.
presentation. It was really helpful.
Yeah.
Okay, well, good. I'm glad. I wanted it to be helpful, and anything that we can learn that helps us avoid pain, helps our blood sugar to stay more stable, and helps us to be mobile. We want to be able to do as much as possible for as long as possible in our lives, and not to have to be on a couch or in a chair all the time. We want to be able to get up and move around and be healthy, take care of ourselves, right?
That's
Right.
right.
Any questions?
I'm good. I'll talk to you on what I've got because I'm under a little different situation, but I'll talk to you about that later.
Yes, you are. Yeah, but I think you're doing wonderfully well. I'm very proud of you, Mr. Reed.
Thank you.
Charlie and Ann have no questions. Or Selma.
No questions?
No question.
All right. So I guess that means it was clear.
Oh yeah.
All right. All right. Well, thank you so much for coming, and we'll look forward to seeing you at the next Zoom, D2 and me.
Thank you very
Thank you
much.
so much, Roberta.
All right.
Thank
Thank you.
Y'all have a good evening.
Bye-bye.
Bye.
Y'all all be blessed.
You too. Bye now.